the key to maintaining a strong long-term relationship. Plus, how well do natural performance enhancers work? Everything you wanted to ask about sex but didn't. Now you can ask Dr. Leah, sexual health expert and associate professor in the Department of Health and Human Performance. Here she is, Dr. Leah.
Thanks, Derek. Great to be here today with all of you. I'm Dr. Leah Janine. We're here to answer your questions about sex and relationships. We have a lot of the latest research and a little common sense. Plus, we have a special guest who will share how he is helping patients with sexual health issues. That's a bit later on, but for now, let's get right to the first question.
That's great. We got a special guest. I'm looking forward to that. Dr. Leah, here's the first question. A woman says, I'm getting so touched out by my kids and it's spilling over to my husband. Help. Dr. Leah, touched out, is that like the kids are touching her so much that then her husband, she doesn't want her husband to touch her? Is that what I'm reading on this question?
Exactly. Maybe it's not the physical touch, but the neediness that accompanies it. Raising children is a full-time job because they depend on you so much. So it could be that your body is telling you you need a break. Know what you're feeling is a natural reaction. So what can you do? First, let your partner know how you feel. Explain to him that it's not that you don't love him or the kids, that you just need some space so you feel like you're more in charge of your body and your time. The same goes for your kids. Let them know you love them, but you need some space and time for yourself. And then build some of that self-time into your routine. Get out of the house for a few minutes, see some friends, make sure you get enough sleep. I know that's hard, but take the help when it's offered and don't be shy about asking for it. Also, keep in mind that physical contact can actually help you overcome your reluctance to being touched, especially when the contact is not about caregiving, but about caring for you. So if your husband offers a hug, take it. Or cuddle with your children, not when they need the comfort, but just enjoy the closeness.
You know, it sounds like communication is the key. Just if something you need to talk about, get it out of your system and go forward.
Absolutely. That's a reoccurring theme here.
Absolutely. Yeah, exactly. Doctor, we have the other question. Our second question. A man asks, at what age does your penis stop growing?
Men's penises grow during puberty, usually between the ages of 9 to 14. But growth can continue into the early 20s. However, that's not as likely. Typically, by the time a man reaches 18 or 19, his penis isn't likely to grow much longer or thicker. Although the growth rate during puberty varies, a study found that the average rate of growth was less than a ½ inch per year for boys between 11 and 15, and then the growth continues after the age of 15, but at a much slower rate. Genetics, hormones, particularly testosterone, determines penis size and varies from person to person. Most penises are between 3.4 and 3.7 inches, but when erect, they can be between 5.1 and 5.7 inches.
Hold on, Dr. Leah, you mentioned testosterone, larger penises in adolescents. Should adolescents go out there and buying testosterone, injecting it into the bodies? I mean, is that going to help them or hurt them?
No, definitely don't want anyone injecting anything into their body. That's a terrible idea. There are natural ways to increase your testosterone. Simply weightlifting is a natural, healthy way. But even that, I have not read any studies that say adolescents that lift weights have bigger penises. So absolutely not.
Okay, gotcha. Well, thank you for the great answer. I've been lifting weights for a while, and anyway, I don't see a difference.
Good luck on that one.
Yeah. A woman says, I'm post-menopause and haven't been sexually active in a while. But when I tried recently, I felt like I was far too tight and lube wasn't really helping. Is there anything I can do at this point?
Well, it could be as simple as she's just nervous or not aroused enough, and after a long time, it could be uncomfortable or painful. If it's just tightness and no pain, the discomfort should disappear after a few times. If the tightness continues, ask a doctor about using a dilator to stretch the vaginal opening back out. If the dryness continues, you may want to try a vaginal moisturizer that you use every 2 to 3 days instead of a lubricant that you're using every time. Also, talk to your partner about it and suggest you spend more time with foreplay.
You know, the question was, post-menopause, but could this be menopause?
It could be caused by menopause. The vagina is made up of valleys and ridges that allow it to expand as much as 200%, and that comes in handy when you give birth. However, when estrogen levels drop after menopause, the vaginal lining thins and becomes less elastic, which gives the vagina less room to stretch. Lower estrogen levels can also make you drier.
Can a doctor help?
Yeah, She should check with her doctor to make sure there's no underlying medical, physical conditions that could be causing the problem. If not, there are treatments that can help with painful intercourse, like low-dose estrogen, or drugs that are non-hormonal that act like estrogen but without the increased risk for breast or uterine cancer.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. You can find out more about sex talk at AskDrLeah.com. Still to come on Sex Talk. The keys to maintaining long-term relationships. Another segment of Sex Talk's new series, Taking It to the Streets. And a men's sexual health expert talks about recovery from prostate cancer.
How do you go from falling in love to staying in love? Well, we have some tips from a few psychologists.
If you're curious about the key to lasting relationships, it's safe to say there's no one right answer. But there are some basics from experts and couples themselves. Strong relationships are founded on good communication. So understanding yourself, how you communicate, as well as how your partner communicates, is very important. If there's a disconnect and you both are struggling in this area, try occasional check-ins, giving you and your partner a safe space to have a discussion. Continue to grow as an individual and work on yourself. Everyone has something to work on. If you find yourself too closed off, for example, try to intentionally open up more. If you're often argumentative or defensive, try to understand why and be open to new perspectives about how to communicate. Also, in healthy relationships, learning to compromise is key. You won't always agree, so compromises allow couples to be selfless and find common ground. Finally, maintaining a long-term relationship requires maintaining a connection. Continue to find joy and do things together. Reminisce on what brought you together in the first place and work towards making new memories.
These are just a few tips. Start small and think, what can you do today to better yourself and your relationship? Coming up, we have a special guest here to share his expertise on common sex issues in men. Plus, we will get into natural enhancers and what really works. We are on the streets. Typically, you guys are asking me questions, but now we are turning the tables and I'm asking you all questions. Hookies, yay or nay?
Nay. Nay. No, you can't do hickeys, you know. I guess hickeys have a place, but it has to be somewhere that's not visible. So,
I couldn't agree
non-visible,
more.
you're okay. If it's visible, a little tacky.
You're a professional after the age of 18, like, no.
You got to figure it out by
No,
then.
absolutely not.
For sure.
Not since like the.
Yes, you're right. Not since, not on me, but on you.
Oh, it's been a while.
Yeah.
So I'm going to give you like a very juvenile one, but people have asked this. What do we think of hickeys? Yay or nay?
Nay.
I agree, like past a certain age, it's just not a cool thing.
So 1998.
All right, so what is your favorite part of your partner's body?
His brain.
His brain.
Hey, quick witty sense
It's
of humor.
PBS,
goes a lot.
right?
Yeah.
Intelligence. So brain's a sense of humor.
Yep, exactly.
Intelligence. Generosity.
Yeah.
Like a yeah.
That's good. That's not a body part.
That's true. Well, I mean, but it's part of the brain.
It's part of the brain. That's true. Okay. All right.
My favorite body part of man, I would probably have to say be the hands, just because they can portray strength, and then a lot of things you can do with your hands. That's all I'll get into. So.
Nice. Okay. Good.
Welcome back to Sex Talk. Today we have men's sexual health expert who's chief of urology and professor of medicine, Dr. Daniel Martinez. Thank you so much for joining us.
Thanks for having me.
Awesome. We're here to talk about prostate issues. It's not a fun topic, but really quite common. So how do prostate issues affect someone's sex life, libido?
Well, prostate issues, again, is something that's inevitable. Every man has a prostate. Eventually, this prostate, which, by the way, it plays a very important purpose in a man's life because it provides the bulk of a man's ejaculate. So what they're able to reproduce with, the bulk of that ejaculate actually comes from that prostate and seminal vessel. So it's not a rudimentary organ like the appendix. It actually has a purpose. But unfortunately, as we get older, certain things can start to happen. That prostate can start to grow. That's a benign process, but it definitely causes issues with urination and quality of life. It can develop cancer. It's the most common cancer that men get. And even at the younger ages, we may also see some issues with the prostate, such as prostatitis, inflammation. That's this chronic inflammation of the prostate, which can cause infections, urinary tract infections, pelvic pain. So all of this stuff can affect a man's sexual function. It can affect their voiding habits. It can also cause issues just such as death, because ultimately you can die of prostate cancer.
So if one of your clients has prostate cancer or they're going through prostate cancer treatment, what do you recommend that they do to improve or maintain their sex life?
The best way I can describe them is rehabilitation, rehab, which rehab in the orthopedic realm is very normal, right? You injure your ankle or your knee, you go and do certain exercises, you do certain things to try to regain function. So one of the things for men who, yes, unfortunately, the treatments for prostate cancer can have sexual side effects. One of the things that men can do is put themselves on a rehabilitation protocol. There's two parts to that, at least with my protocol. You can use phosphodiesterase inhibitors, so the Cialis, a low-dose Cialis a couple times a week or every day. That'll help. Helps increase blood flow to the area. And you can also buy a vacuum erection device, or a VED. Everybody laughs about it because they think of, oh, isn't that a sex toy? Well, no, it's an actual medical-grade device, which is what they should purchase, a medical-grade device, that you can use to try to rehabilitate your penis and regain some of what you've lost and or maintain, not just function, but also size and girth. So.
Awesome. So last question, is there any final tips that you have for people that want to maintain or really improve their prostate health?
Yeah, live a healthy lifestyle. You know, a lot of the stuff that we do, we put into our bodies, diet-wise, exercise-wise, it's going to affect all your organs, including your prostate. Eating unhealthy, a lot of fatty foods, the unhealthy fats, a lot of alcohol, a lot of caffeine, that can all irritate the prostate. It can cause issues such as prostatitis. So trying to maintain a healthy lifestyle is very important. Other than that, again, the importance of actually going to see your doctors, seeing your primary care, seeing your urologist, getting your colonoscopy, doing all that stuff is very important for your overall health. So I would say live healthy, see your doctors, exercise regularly, and in the end, you're probably going to be fine.
Perfect. That seems like a reoccurring theme in this show. Well, thanks, Danny. We're going to take a quick break. Stay with us for more sex talk.
Coming up, what to know about getting circumcised as an adult? What exactly is urethral sounding? What are some of the benefits of sex? And should you abstain from sexual activity if you're taking medication for an STI? That and more ahead on Sex Talk.
We're back here on Sex Talk. Let's get right to the next question.
Great questions and great answers, Dr. Leah. And here's another great one. A 32-year-old man says, lately I've been self-conscious about my uncircumcised penis and have been thinking about getting circumcised. I can't tell if it will affect my sex life.
Getting circumcised as an adult won't affect your ability to have sex. A study between men who were circumcised after they were adults and uncircumcised men concluded that there were no significant differences in sexual drive, erection, or ejaculation. However, self-pleasure decreases in almost 50% of participants, and 20% reported a worse sex life. This study concluded that the decrease in masturbation, pleasure, and sexual enjoyment after circumcision was possibly caused by complications during the surgery or a loss of nerve endings. It is interesting to note that circumcision was originally pushed as a means to prevent masturbation. And while it appears that it doesn't decrease the frequency, studies show that pleasure from masturbation did go down in a significant number of men. There are, however, some health benefits to being circumcised, including a reduced risk of penile cancer and other sexually transmitted infections.
Dr. Leah, penile cancer. It's the same as testicular cancer? I mean, I've never heard of penile cancer. I guess you can get cancer anywhere in your body, but penile cancer?
Yeah, you can get penile cancer, and in some really bad conditions, the penis actually has to be removed. Yeah, that's not very common. It's typically just going to be on the tip of the skin, which is why the foreskin's cut off. It decreases your likelihood of penile cancer.
And Dr. Lee, also, you mentioned that pleasure went down with masturbation. You would think it'd be more because you're exposing the head of the penis where there's more nerve, I guess?
Well, the theory behind it is that, think about this, like your hands aren't very sensitive because they're more aggressive, they touch more things versus like the back of your knee, for instance. So if I were to rub sandpaper on your hands, you wouldn't feel the same pain as if I went to the back of your knee. So if that area is always enclosed, then it's more sensitive when it's exposed versus if it's hitting underwear or jeans or whatever it may be, then the area, that's the theory behind it, that it's getting already more exposure to sensation.
Okay, a great answer. Our next one. My boyfriend wants to try inserting something metal into his private area. He thinks it will add some spark. I looked it up. It's called Uretheral Sounding, and it sounds dangerous.
Yes, it can be very dangerous. Uretheral sounding is a part of a medical procedure that inserts a sterile object into the urethra to provide access to the bladder during urological surgery. The practice of urethral sounding has become popular because it's believed by users to heighten sexual pleasure and arousal. But there's a high risk of injury. The inserted object can go deep into the urethra and not be able to be removed. And that's why some users end up in the ER. There's also a risk of urinary tract infections because most objects used by individuals are not sterile. Some common household items that have been used are like pencils, screws, any phallus-shaped fruits and vegetables. Not a good idea. Other complications that could happen are incontinence and chronic renal failure.
You know, where do you think this idea of inserting things in your urethras came from? I mean, you know, it doesn't sound very good to me.
I have absolutely no clue why. Yeah. Just let's try this.
I guess like anything else, it's like, you know, the risk versus the rewards. You know, I guess before you engage it, and when you're aroused, sometimes you'll try different things. I guess you have to like say, okay, is this going to be worth the 30-second or 10-second enjoyment I'm going to get out of this?
Yeah, inserting anything not sterile into any orifice, bad call, bad idea.
If you have a question for Dr. Leah, please send an email to questions@allhealthtv.com. Find out more about sex talk. Go to askdrleah.com.
It's no surprise that sex can be good for you, but did you know the benefits can be long-lasting? Here are some interesting ways that sex is good for us.
From our emotions to our physical well-being, the benefits of sex affect all aspects of our life, proving that sex is good for you in many ways. There are several physical benefits. While you can burn a few calories, sex gets you moving and can allow your body to work different muscles. This includes working the pelvic floor muscles, the muscles that are important for bladder control. And if you're feeling stressed out, sex can be a natural stress reliever. During sex, the body releases stress-relieving chemicals like oxytocin and endorphins, while stress-inducing chemicals like cortisol are lowered. Sex has also been known to prevent an increase in blood pressure. In men who are sexually active, studies have shown a decrease in prostate cancer rates. Women may benefit from a lower risk of heart disease. Some women find that more sexual activity can actually delay menopause. Other ways that sex is good for you include helping you sleep better, alleviating chronic pain, and building a better immune system.
We're always covering the benefits of sex here on Sex Talk. Let's take some more questions.
Excellent. Here's another great question. A viewer asks, can you have sex while taking meds for a STI? My girlfriend has it too, but we are both on medicine for it.
The safe answer is to wait at least 7 days if you're on a single dose of antibiotics or finish your treatment. However, if you have chlamydia, gonorrhea, or syphilis, you can have sex if you have a condom until both of you complete the treatment and don't have any open lesions. If that's the case, you could pass the infection back and forth, so you'll need to wait until the lesions clear up. Same advice goes for herpes. If you're in a monogamous relationship and you are both free of infection after the treatment, you should still wait 7 days before going back to oral, anal, and vaginal without protection. And remember, keep up with STI screenings.
I guess this in case this patience is a virtue really is valid here.
Absolutely, because if you're passing it back and forth, you're going to keep going back to the doctor.
Yeah, you'll never get rid of it. Dr. Leah, a man says, my mouth gets so sore after oral sex, sometimes for a week. What can I do?
It could depend on the type of soreness that you're experiencing. TMJ, a disorder of the jaw joint, oral sex, or even kissing can trigger it. If the pain is in your jaw and muscles, any open mouth activity can aggravate it. Many people suffer from it and can affect your sex life because of the pain. There are treatments. If you have it, you might want to check your doctor to see if TMJ is actually the problem. But if you're talking about soreness in your mouth, you might have an STD, such as chlamydia, gonorrhea, or herpes. Some of these infections do not have symptoms, and when they do, they're usually seen as a sore throat. If you think you have an STD or STI, you should speak with your partner and explain the problem. They might not know if they're infected, or you could be passing the infection back and forth. Then go see a doctor, get tested, even if you don't have any symptoms. Most STDs are easily treated with antibiotics.
So just to clarify something, Dr. Leah, because in a couple of questions ago, you also mentioned chlamydia. Chlamydia came up again. You mentioned herpes and you mentioned gonorrhea. Herpes, you can see a sore or feel something in your mouth. Gonorrhea, it's burning sensation while you urinate. Chlamydia, how do you know you have chlamydia? You did say there's some things you can't really tell, but how do you know?
Yeah, sometimes people don't experience any symptoms at all. Gonorrhea and chlamydia have similar symptoms, and both of those can be treated with antibiotics. Herpes cannot be treated with antibiotics. It is viral, so antibiotics don't work. And obviously antibiotics only work with bacterial infections, so that presents itself a little bit differently.
Dr. Leah, there's something that I get confused with, and I'm sure a lot of people do. What's the difference when they say STI versus STD? Is there a difference?
There actually isn't. So when I was in college, it was referred to as sexually transmitted disease. And then they changed it to sexually transmitted infection because they felt like disease was just a little bit harsh and made people feel negative about themselves, and people were less likely to get tested, versus an infection seemed to be fleeing. But it's important on both of these to understand that not everybody experiences symptoms. So just because you're with a partner that says they're feeling great and you don't see any lesions, it doesn't mean that they don't have it.
Okay. Great, thank you. Our next question. A man asks, how do natural performance enhancers or herbal supplements compare to other options?
The quick answer is they really don't. But that's not the whole answer. Most male enhancement pills are labeled as dietary supplements. That's because they aren't approved by the FDA, since there is little scientific proof that they work. They may also include unlisted active ingredients that could be harmful, especially if you're on other medications or supplements. There are some claims for a few of the most common ingredients that are found in the supplements. One study did find that black ginger root increased performance and endurance in mice, not humans. Traditional herbs like horny goat weed have been around for a long time and are still on the market. The herb contains chemicals that might increase blood flow and improve sexual function, but it comes with some of the same problems of other male enhancement pills. Viagra and other prescription medications are still the most proven way to restore erections.
Dr. Leah, sorry, I'm still kind of laughing at the horny goat weed thing. Appropriately named. I'm sorry, I've got two more questions. You said Viagra and other prescription medication. Are you talking about other brand names or for sildenafil? Or are you talking about, is there something else other than that?
Oh, no, like Cialis, Levitra.
Okay, so
those are going to be
names.
some other prescription. And as to the horny goat weed, I actually did a presentation at a national conference on horny goat weed, as well as maca and other supplements. And yes, everyone thought that was really funny. And I was like, yes, as the name says. I believe it has to do with the actual plant, not having to do with anything else. But.
Okay. My other question on that particular part was, you mentioned all the supplements. You'll go into a health food store and you'll go to like the kind of the workout section, I guess. You see all these jars, colorful, big labels on them, increase your testosterone, be a man, all that kind of stuff. I mean, I guess those things work?
really, if somebody has low testosterone, which you have to check with your doctor, then your doctor, you can go in and then work with testosterone supplementation that way. And typically it's not oral supplementation that you're going to a doctor for. So avoid that. But there's quick and easy things that you can do, like start lifting weights. Your body naturally produces testosterone, especially if you're doing exercises that involve large muscle groups like squats or deadlifts.
Beautiful, great. So not just supplements, exercise, healthy living, good eating, etc.
Yeah, absolutely. And if somebody has low testosterone, that's one thing. But if somebody's just guessing, like, hey, my testosterone may be low, let's take a bunch of these pills, not a good call. Okay. Well, Derek, that is all the time we have for today, but you can still send in your questions. I'm Dr. Leah Janine, and we will see you next time when we answer the questions you always wanted to ask on Sex Talk.